What's up, guys? It's Dr. G. I hope everybody's doing good. I'm at work right now. It's early in the morning. This thought just came to me. I wanted to just go ahead and talk about this. I've been meaning to talk about this for quite some time now. It actually pertains to family medicine residency. I always thought to myself, it's exciting getting into residency and all that stuff. You're happy to be here and everything, but there are a lot of things that I didn't know coming into residency, and I'm sure there are also a lot of people that think the same way as well. You get to that point, it's like, yes, I'm glad, I'm super grateful that I finally matched into residency, and then there we go. We're now in residency. So what I want to talk about today, guys, is the things that no one told you coming into residency, because I certainly didn't know some of these things. So before we get started, I need you guys to go ahead and click that subscribe button. Again, thank you for doing that. Let's go ahead. So the first thing for me is, I honestly didn't know the scheduling for residency. Now, I'm particularly talking about family residency. The scheduling is more like, so you can call it medical school 2.0, the same way you have these different rotations in medical schools, like different specialties, surgery, orthopedics, pediatrics, inpatient, outpatient, all of that stuff. It's the same thing in residency. Honestly, I didn't know that. It's more like, so I call it, again, medical school 2.0, 2.0 in the sense that you do have more responsibilities now when you're seeing these patients. But as far as like all of these rotations and stuff, you have the same, almost the same thing. Maybe slight variation there as far as what specialty you are in, I guess. So that was one of the things for me. I was like, oh wow, this is basically medical school. Like, we're sort of doing those rotations all over again. And then the other thing is the scheduling. So still talking about your specific scheduling in family residency. My goodness, it's like some days so if you're in actual, let's say you're in surgery rotation, you'll be in surgery rotation in the morning, and in the afternoon you might have to go to your continuity clinic, so which is your clinic where you see your patients, the patient panel that you manage, so you see them in the afternoon. And then the other thing for me was, oh my goodness, after you're done so rotation, say surgery in the morning, and in the afternoon you're in the clinic, and then later on that night you're probably on call in the hospital. Like, oh my goodness, like, wow, crazy kind of schedule. I didn't know that coming into residency. And they also go based on, like, it's more of a block-based system, so it's block by block. It's like a month, each month is a block. So 1 month of surgery, 1 month of emergency medicine, another month of maybe OB, another month of pediatrics. So it's a block-based system. That I learned about that when I started residency. I got to see that kind of scheduling, but I wasn't aware of that coming in. And I just mentioned being on call. This was another thing for me coming on. I'll always hear them talk about on call. Now, when you say on call, the idea of on call is while you are wherever you are, you have a pager, they have your phone, and they'll call you wherever you are and stuff. But no, like, my program is an in-house call. So when they say, oh, you're on call, well, call basically means you are in the hospital, you guys stationed, just waiting to be called for admissions. And those calls, especially at nighttime, so let's say you are on call overnight. On call overnight doesn't mean you go home and chill at home and wait for them to call you. No, for us here, it's like you have to be in the hospital in order to take those calls. Honestly, I didn't get that part. I remember one of the hospitals I interviewed at, I think it was University of Illinois. Their call was actually from home. So especially when you were in second or third year, you'll be taking calls from home. But for my program here, we only do in-house calls. That means you are in the hospital. I guess that's how some of the residency programs are. But in my mind, for whatever reason, I always just figured you're on call. Yes, you're not in the hospital, but that's something to call. The next thing is sleep. I know everyone always talks about how stressful residency is, how hectic the schedule is and all that. I heard all that before starting my residency program and all, but oh my goodness, I did not know how badly this whole sleep deprivation thing will hit me, to be honest, especially when you're an inpatient service. So any of the inpatient services, especially inpatient adult service, most times you're having to wake up like 5 in the morning or 4 sometimes, just to read up on your patients and then try to get in as quickly as possible to get handoff from the current overnight team so you can get ready for the day. And of course, you don't leave until the next 12 hours, and after that if you're actually on call. Say if it's a weekend, sometimes you end up like doing 24 hours in a row and all that. So I like to tell people it's exciting getting that call, or actually getting that email that you've matched into residency. But then when you finally start, you're like, my goodness, what have I gotten myself into? I get medical students also, so they rotate with me. I also get PA student. I actually had one that was like, the reason he went to PA school was because he didn't want to deal with the stress of residency, which understandably I get it. But the good part, I guess, we hope for that light at the end of the tunnel. Like when all this is over, it'll be much better. But while you're in it, oh, believe me, it's not fun. It's not fun. And let me tell you about those rotations that I talked about. There are some rotations that most times you just ask yourself, why the heck am I here? Because I don't want to do this when I go into practice, One for me was like women's health. I was amazed at the sheer amount of women's health, like obstetrics, like deliveries and stuff like that, that I had to be involved in, because I always said to myself, like, I don't want to do that in practice. I really don't. But then again, I get it. They want to train you to be a full-fledged family physician, the good old school family doctor that gets to do it all. But in reality, am I going to do that in practice when I get out of here? Heck no, I'm not. But again, it's one of those things. I was not prepared for the sheer amount of women's health, like child deliveries and the brand new babies and everything that you have to do, but there's some rotations that you do and you just love it. You're like, oh, this is my niche. This is totally where I want to be, And I kind of think it makes sense too, just because we're so different. We all have different personalities. Like, I love emergency medicine, and there are people in my program, they're like, heck no, you couldn't pay me enough to work in the ED. So they also give you the option of elective rotations. That way you can sort of tailor your training to what you plan to do in practice. Of course, for me, I've spent a lot of my electives in the emergency rooms, just kind of hanging out over there, trying to see what trouble I can get into. Don't just kid, no trouble, just exciting stuff. The emergency room, I see it as organized chaos. And I do like outpatient as well. So the clinic, emergency medicine, those rotations, when I do them, like, oh yes, this is my territory, this is my happy place, as opposed to somebody else that may be like, oh, inpatient, like hospitalist kind of work, or pediatrics or deliveries and all that. That's what they love. And I get it. It makes sense that, we get to do all the different things because each person's interested in different aspect of family medicine. So I guess I get it, but just one of those things that I wasn't aware of, I felt I needed to mention. And the other thing that I do have to mention is, imagine this. You take a whole group of like very smart people, kind of put them together to work together. My gosh, that's a lot of pressure there. And it's constant, like you see people constantly working to compete, like they're competing or trying to show, I'm the smartest one, I'm the smartest resident, I'm the smartest physician. And most days I'm like, we're not in high school, right? We're not in medical school even. I mean, this is residency, but it's one of those things that you got to deal with. And the very last part I want to talk about is time away from residency, so your vacation. Now, this one's actually determined by the ACGME, the accreditation body that accredits residency programs. So for us, for family medicine, I don't know for other specialties, but I do know for family medicine, we're only allowed like 3 weeks of vacation out of a year. So most times for me, I usually just use mine to go home, just spend time with family, hang out with the kids, and do all the things that we haven't had a chance to do in a long time, because most times. But when I'm not able to go on vacation, I guess we literally just live on FaceTime, talk to the kids, find out what's going on, help them pick out their school clothes. And it gets tough though, it does get tough, especially if you're someone that has family, you have kids, and you're away from them, like in my situation. So that's the thing. And as far as vacation too, the other part that I didn't know, guys, is, I don't know if this is specific to my programs or if other places do that, but the fact that you have all these calls scheduled, even though you're allowed to take off, you have 3 weeks of vacation. You can sort of plan it however you want, but you just cannot go beyond that 21 days that's approved. But if you do decide to take your vacation, and say you have calls scheduled, so you're on call and everything like that, you're not even going to be automatically taken off the schedule for that. You're going to have to shop around. Try to see who's going to swap with you, right? Can you trade call shifts with somebody else just to find coverage for that. So, but if you can't find coverage, well, guess what? You ain't going nowhere because you are fully or wholly responsible for that call. I've been fortunate in my class. We have built sort of a very good rapport with each other, so we kind of cover for each other. Most times we just sort of swap if someone has something going on, maybe kids. So your maybe family functions or any kind of family obligation, you need to go home and do something or whatever you have planned. And some people even had like prior engagements before we started. So what we do is kind of cover for each other so that we can get a chance to take a break from this sometimes, because you do need that wellness aspect of residence. If not, your mind is just gonna go psh. I mean, oh my goodness. If not, you may just lose it because it's a high stress level environment, and it's like we have to find ways to relieve that stress. You know, most times we go out, most times we hang out, but me personally, some days I just watch Netflix or talk to the kids, and some other days I'm making YouTube videos, some other days I'm studying, and some days I'm just trying to catch up on sleep. You know, that's a very important part too, trying to catch up on sleep. It's so bad that my body has gotten to the point of, because normally when I'm in inpatient service, I set my alarm to wake up around like 5 o'clock or so. But now it's like, it's so bad that even when I'm no longer in inpatient service, that I set my alarm to wake up much later. It's like that body clock has been rewired. I still find myself waking up like 4:30 or 4 o'clock and not even being able to go back to bed because mine has been messed up from all this, you know, but it's okay. When all this is over, we're going to go back and rewire that brain again, right? You know, they always tell you the first year of residency, every residency is the hardest, the very first year, because you're trying to learn a whole lot. You're adjusting to the schedule, working with new people, trying to learn how to work with each person, different personalities and all that. But they do say from the second and to the third year and beyond, it does get better. So I've got 5 months to finish up the first year, and trust me guys, I'll be making a video to tell you guys how that went. We'll keep this journey recording, okay, until we get to the end of it, and I'll be bringing you guys up to speed as we go along the way, okay? Anyway, let me go get the day started. I have to go upstairs to go check out this new baby that was just delivered, okay? I appreciate you guys again. Thank you so much. Click that subscribe button, all right? Thank you. Bye.